Hi, I'm Kris,
Hi, I'm Amber.
and we're the Plantaz family.
We'd like to share a journey of IVF with you. So, about 2 years ago, Kris and I started our journey for having a baby and started going and seeing doctors, and we got to see a specialist because I have my tubes tied. And we knew that we wanted to have a child together. We just got married this past May. So we want to be proactive about getting my tubes reversed. And we went to the doctor. He set everything up. I went in for surgery, and I was supposed to have a 5-inch incision. Essentially, I woke up and I knew right away that I didn't have a 5-inch incision, which meant that the procedure went really wrong.
Yeah, it definitely took a toll on, especially you, well, both of us, but especially you, just because having to wake up and knowing that everything didn't work out the way we planned, kind of set us back a little bit as far as trying to get the process going.
Yeah, so it was really hard, and I walked away from that emotionally devastated. But we're being seen here at Madigan Army Medical Center. We live up in Washington State, and Dr. Burney kept our spirits high. Although we didn't want to hear it at the time, he sat us down and told us that we had options and that we needed not be too devastated. But what I had was hydrosalpinx, which means that when I ended up having my tubal ligation and they cauterized those tubes, they ended up filling up with amniotic fluid over time, and they enlarged to like the size of small sausages inside, which makes it hard. And so I've been every month when I have my woman time, I end up having pain in that area that is pretty excruciating. And so he let us know that the hydrosalpinx was the reason we couldn't reconnect the tube. It was basically botched on both sides. And that our option would be IVF. And before IVF could begin, 3 months prior, we would have to go in for another surgery to have those hydrosalpinx tubes removed. And happy to say that that was 1 year after we got the devastating news that
On the dot.
on the dot, yeah,
1 year.
it was like our surgiversary.
30.
But we got it done, and we came out, and he gave us the good news that everything was positive, and we could move forth with IVF. So we're on the Lupron protocol. And I have finished all of my first month where we were on the birth control. And I did the Lupron shots for the week and a half. And today we started our
Follistin
and Menopur shots. And so I got to tell you, I don't think that they're as bad as what I've been reading online. And a small thing that I did was I prepared the Menopur first, and I allowed that to sit while I prepared the other 2 injections because it takes a little bit of time. And there's freedommedteach.com. Freedommedteach.com.
Yeah, freedommedteach. I think it's .org. I don't think it's .com. But.
Okay, well, one of those. We went on and we actually watched through the thing, so it helps that way. I know that they teach you in the class and stuff. But it's also there as you go through the steps. So some of those things you really just block out, or you just don't remember when you get home.
Yeah, It's very, concise directions, too. So, it's very blatant right in your face what you need to do step by step by step. So it's pretty good knowledge if you forget a step or if you feel like you're not comfortable with doing everything all together at once.
So we prepared the Menopur first, and that's the one that you do the liquid and the powder mix. And then afterwards, I did the Lupron, which I was used to. And then the reason I didn't do the Follistim first was because it's cold. It's been in the fridge, so I like to let it sit just a little bit. And the other tip that I want to give you is to go slow. So the Menopur, you can feel the burn the faster you go. It definitely pinches, but it's not, the injection itself is not bad. Neither is Lupron and neither is the Follistim. It's about, I think, the way you inject yourself with it. And I've had prior stretch marks too, so if you have that as well, you might want to avoid that area. There's one point, like I was really willing
Yeah.
to re-stick myself. Like I pulled it out and I was like, not there.
Yeah.
So it was pretty rough.
Yeah.
But I think overall in this journey, what we'd like to share is honestly how emotionally prepared you have to be. It's
Yeah, just especially the fear of everything not turning out the way it was supposed to be. You know, you put all this time, money and effort into something that you truly don't really, you're not really guaranteed something in the end of it. So I guess having to be prepared for the outcome to not be your way could be a lot harder for some people than others.
yeah, we're definitely being realistic. Like you want to stay positive in the whole journey. You want to be positive for sure. Stress isn't going to help you at all. So you want to eliminate
Yeah.
as many areas of stress as you can, whether that's family, friends, work, yourself. Like the way you really have to get mentally prepared, you and your spouse or whoever you're doing this journey with. Ultimately, they just need to be there to help support you and guide you through it. And yeah, just minimize that stress as much as you can.
Even though you're stressing the whole time you're doing IVF anyway, but trying
You
to
do.
minimize it to as much as you can. Just trying to stay calm and not constantly worry the whole entire time what'll be the outcome of it, and just kind of go along with the ride of it.
So our goal, other than to provide tips and things, is also to kind of document our journey. We're starting later in the process. We had planned to start earlier. I had made one initial video that was by myself because Kris was out at training at NTC, so he's in the military. And he was at training. And so I had made these videos, and I had actually lost a lot of weight to prepare for IVF, and about quite a bit down. I was at least 40 pounds from starting.
Yeah, it was like 40 pounds.
And then I had lost a lot of weight knowing that we were going to be going into this and for the wedding back in January. But we came across some issues right after that surgery, like right during that time. So we had the surgery, and then a couple days later, I was diagnosed with ulcerative colitis disease, which is an autoimmune disease. And I had to be put on prednisone, and prednisone does this to me. So in a few short weeks, I gained quite a bit of weight. And it's really disappointing. It's quite a big setback, I think, for both of us. It almost halted our IVF process because prednisone can cause contraindications in other areas. Not specifically with the IVF process, but more part with the sedation aspect of everything and
With
doing
the
anesthesia.
Yeah.
So that was really rough, but we were really blessed to hear that they decided to go ahead and let us move forward with the process. They felt like my taper was well enough within range. So
Yeah, because you tapered all the way down to 10 milligrams, and then you stopped it for weeks before we actually started our cycle. So by then it was fine, according to the anesthesiologist, to go forth with sedating you at the point that you would need to be sedated.
So that was really good news for us, and we were able to proceed. So I know we're starting a little bit late, but going through the stuff that I've already gone through, I will just kind of hit on some of those things. Is one, those earlier months, try to prepare yourself as much as possible. Be in the best physical condition you can be, and that doesn't necessarily mean running and exercising and being crazy, but just trying to eat right and taking care of your body. I started taking prenatal vitamins and fish oil way ahead of time. So I've been about 2 months now taking those every single day consecutively, and just really taking care of myself and thinking positive thoughts. And I will tell you this, nobody tells you that the Lupron makes you angry, but it makes you a little angry. And it makes sense because it kind of puts you into a menopausal state. So that way they can control everything going on with your body.
Yeah.
So I wouldn't say that you're angry all the time, or like, I wouldn't even say that it's close to having like a period and being angry. I would say it's more like Hulk moments, like something irritates you and you just lose that control. Like you don't have that natural control maybe that you would have. For me, like that's how I am. I get angry and usually I can just calm myself down before it reaches the surface. But with this Lupron, that's not been so effective, has it, honey? So he's been really patient. So you can see the face. He's been really patient with me and kind. So remember, try to be patient for the person that's going through it. Try to understand what they're going through. But another thing is that Lupron, Menopur, and Follistim all come with side effects. Not everybody suffers with the same side effects, but I will tell you, with having all of the injections, the ones that I've had for Lupron, the moodiness, the injection site, not as painful as what they say until like 1 to 2 minutes afterwards. I start to feel warm all over my body and I become extremely tired. And that tired duration can last 1 to 2 hours. I've not had it go over the 2-hour mark, but sometimes it's enough to just knock me out, like completely pass out.
Yeah.
And so if that happens to you, you want to be cognizant of where you are when you're taking those injections, and make sure that you're somewhere that if that happens to you, you can go to sleep. And then it also stings a little bit, like a little bit. I wouldn't say that it's crazy bad. It's definitely an after effect, though. It makes your stomach itch. Just try not to itch that site of where you injected.
Yeah, I would definitely say on that note with the Lupron. I mean, I guess it's for all medications you'll be injecting, but especially, I think definitely the first time you try any of the medication that they give you after you inject it, definitely at least give it like 15 to 20 minutes to see what kind of side effects you have. Just because, like, when she really means that it knocks her out, it really knocks her out. So, like, you know, I wouldn't feel comfortable, like, her going and making a 30-hour drive to work right after she take that.
A 30-hour drive?
Or a 30-minute drive, sorry. Not 30-hour drive.
All 30 hours.
All 30 hours. Yeah, just small things like that to keep in mind. Like, if you need to go do anything, definitely don't be, like, you don't want to start your medication, obviously, on a day you have tons of things to do just because you just don't really know how to react to it, or you don't know how your body's going to react after you take it. So definitely
be prepared. Be prepared. Read the side effects. Kris and I decided when we first started the journey that we didn't want to get online and go through the IVF process and read everything and watch all the videos. And we did this to safeguard ourselves, because I felt like sometimes you can get over inundated with information, and that can play a huge role in how you go through the process, and it can make you more nervous. You know, there's a lot more people that are willing to comment about the negative things than really the positive things. And so I think through the process, I wouldn't say that the shots are awful. You do inject, we know that you've got to inject, and it's 3 injections a day, depending on which protocol you're on. But for the Lupron one, the long-term Lupron one that I'm on, it's 3 injections max a day. And then you get your blood work, and then you have your trigger shot. And so I haven't got to trigger shot yet, so I can't necessarily say, but the trigger shot's 1 injection, like 1. And I think the having a baby and having that family aspect way outweighs what the process that you're going to go through here.
Yeah.
And pregnancy does that anyway, just when you...
I mean, considering there's always that few group of people there's usually always a couple people in a group at a time that usually are deathly afraid of needles too. And I mean, that might be hard for you to get used to the injecting yourself, or if you do have your husband or whoever is doing it for you, you know, it may be hard for you to get used to just doing it by yourself in case they're not there at a certain time, because you're supposed to take it usually, well, for us, within the 2-hour window that's specified by your doctor. So, you know, sometimes if the person's not there to do it for you, you definitely want to be able to be capable of doing it yourself, because if you go past those times or do weight earlier, and the next day it's 2 hours later, and it's not a kind of a consistent
schedule.
Yeah, consistent schedule. It could throw off your cycle, which you don't want to do.
Yeah. So we'll do another video about like what our process has been with the medication and what we did and all of that, because honestly it's really important to be organized. We walked out of the pharmacy with a bag that, like Walmart, it was filled with medicine. So you definitely want to be prepared for that, and we'll do a video of that type of thing so that way you guys can see that. And we'll try to do videos every day from this point on, because we only have 3 weeks left, which is great. Next week will be our the HCG trigger shot and lots of ultrasounds, and then once they say that we've got the go ahead, like I said, we'll do the trigger shot, and then we'll have the surgery to have the eggs removed. And then 3 to 5 days later, we should be up for that embryo transfer. Hopefully, if everything was successful. So, which we're hoping for.
Yeah.
Another thing I think we should mention is that Kris, when we got the news about me, we were devastated, and then we got news about Kris. And the delicacy of his sperm and the condition that it was in was he lacked motility, which means that it's healthy sperm, but the motility, the way that it moves and its ability to actually penetrate the egg may be a little bit more on the weaker side. So we are having to pay a little bit more for the ICSI process. And all that is they take the sperm, the healthiest sperm that they separate and clean and get it prepared. They actually inject it into the egg and watch that become an embryo. The same way that the process would be through natural selection, it just would be done with the ICSI process. So I don't know if you have anything you want to say on that.
Just on that was also during a time when I was also smoking as well, so I'm sure that played a big factor in it. So if you do smoke, and I wouldn't say necessarily I'm a heavy smoker, but I'd smoke about 4 cigarettes a day, 4 or 5 cigarettes a day. So I mean, if you're smoking around that, and I've never had any problems as far as being reproductive or anything as far as that goes before. So, if you're a smoker, definitely consider stop at least 2-3 weeks before you go in and do the test to see what your sperm looks like, because if you do have some kind of fertile problem and then you're smoking on top of it, it makes it a lot more difficult for you.
Want to be the healthiest you can be both ways. So Kris and I have been doing it together. He's stopped smoking since we started this process. So that's been a really great thing. But definitely want to take care of yourself and want to get to the point of being the healthiest you can possibly be. Super, super important. I mean, you're paying all this money and you're injecting yourself and you're putting your body through things that wouldn't naturally go through. So you want to be the best you want it to be the best that it can be, and you want to give yourself the most optimal chances to getting pregnant. And it's hard to read, but when you read the actual percentage of people that become pregnant, it's not on the high end. I was reading it was like 37 to like 40%, and so just one of those things you just really want to be prepared. But that's all for this video, and we will be updating you. We've got a couple appointments coming up. One is going to be this Friday, which is the 19th, and then we have another one on Monday the 22nd. So, it's the exciting time, and we hope that you'll follow our video. And if you have questions, comment below. Bye.